we also have even more people coming together, but it's also based on the same human rights principles, because it just gets rid of all the arguments that have technical points here and there or numbers here and there that A, a lot of people feel they can't grasp because they don't know enough, or that B, anytime I use a number, somebody can always come up with something from the internet that says that's the wrong number, and I get totally diverted if I do that from the main idea that healthcare is a human right, and that if you're human, you're united in suffering. And that's why we use stories a lot, because I can take the richest person in Vermont and ask them to sit with the poorest person in Vermont and tell each other a horror story about healthcare, either of themselves or a friend or a family, because we know everybody has one. I've never met anybody who says, no, I don't know anybody that has a healthcare problem. And even though the great disparity of economics exists between those two folks, when they're looking each other in the face and looking each other in the eyes as just two human beings united in suffering, that is a total leveling effect. All of a sudden there is that bond of humanness there. And so that allows them to be united across these differences that otherwise would never allow them to come together. And since movements are built on relationships, that's the first step, is looking at somebody in the face and sharing information or saying hello, to building a movement where the people can remind the government that they work for us, not the other way around.